Breast cancer patients who need radiation therapy typically need 6 weeks of treatments. Imagine reducing that to 5 days without side effects. Dr. Frank Binberger of Methodist Charlton Medical Center is here to tell us about this exciting breakthrough. Doctor, you bring good news today. How are you?
I'm doing very well, thank you. Typically, patients have had to undergo 6 weeks of radiation therapy when they have breast conservation therapy.
Right.
Now, we know that a mastectomy is equivalent to a lumpectomy if you have radiation in conjunction with it.
Okay.
But we're trying to reduce that time period where you get radiation down to 5 days instead of 6 weeks.
Wow, that's amazing. This innovation is just huge. And how does this work that you can just reduce it to 5 days from the standard 6 weeks?
Basically, what we do is we're able to place a catheter into the breast lumpectomy site, and then we can actually expand that catheter and directly put radiation right around to where the lumpectomy site is. And that allows us to directly radiate the area where the tumor is as opposed to radiating the rest of the breast.
Wow, it's really great. So talk about the SAVI and how it works.
Well, the SAVI device is usually used in patients who have early stage breast cancer. That's patients who have smaller tumors, who have no spread to the lymph nodes.
Okay.
And what we do is after we get the pathology back, we're able to place this in the office. And so we usually do it under ultrasound guidance, and the catheter itself expands to fit the cavity of the lumpectomy site. The catheter itself expands like this. And when we put it into the lumpectomy site, it fills the lumpectomy site space. And so we're able to expand it up and fill the lumpectomy site space. And each of these struts is able to directly deliver radiation. So each one of these little struts is able to be selectively radiated. And by doing that, it allows us to radiate more in one area or another depending on how much radiation is delivered through each of the struts. And by doing this on twice a day for 5 days, we're able to get as much radiation to that area locally as we would with a 6-week typical traditional radiation.
So what I'm hearing is not only is this so great for the patient who doesn't have to suffer through 6 weeks of treatment, that we're cutting it down to 5 days, but it is as equally as effective.
And that's right. It's what we want to get is something that's equally as effective. Typically with breast cancer, we've moved towards techniques that are going to give us the same effect with less invasive techniques. 30 years ago, we were doing radical mastectomies. We were taking off all the muscles in the breast. Then we moved to lumpectomies and then to sentinel nodes. We were only selectively biopsying the certain lymph nodes as opposed to taking out all the lymph nodes. Now we're looking at radiation and saying, can we minimize this and still get the same effect? And the benefits are that we're not we're not radiating the whole breast, so you don't have the damage to the tissue of the radiation damage to the whole breast. You're able to focus it so that you're not damaging surrounding organs like radiation to the heart. And so overall it provides in certain patients it provides a very good option.
That's really great. You really did bring some really cool and very good news today, Doctor. Thank you so much for being here. And if you want to learn more about the SAVI treatment, breast health, and other women's issues, come out and meet the doctor and other Methodist Health System physicians this Saturday at the Girl Talk event. It's from 10 a.m. to noon at Methodist Charlton Medical Center, and that's in Dallas. And just log on to methodisthealthsystem.org/girltalk or give them a call, 214-947-0000 for more information. Doctor, thank you so much, and we'll send it over to you, Chris.